So thanks everybody and good morning. My name is Lindsey McLean. I work for the NHS for Wye Valley NHS Trust, and I'm going to talk to you this morning around an alternative approach to improvement and some of the learning that we've had over the past 5 years. So before I start, I'm going to introduce myself, and I'd quite like you to introduce yourself as well into chat for me. So my name is Lindsey McLean. Like I said, I'm currently the Urgent Care Programme Manager at a NHS Trust called Wye Valley NHS Trust. That's down in Herefordshire in the UK on the border with Wales. And I've got this year, September will be my 20th work anniversary working in the health system in Herefordshire. I live in a beautiful place called Ross-on-Wye in Herefordshire, and when I am not talking about improvement, I'm out with my family either on the water on a paddleboard or in the water wild swimming. I did try to find a picture of a wild swimming photo of me. Chose not to decided not to use that one this morning. I looked very cold. I looked very cold on that one. So that's who I am. So in chat, can you pop your name and your role and maybe your organisation that you work for? It's always great to see who we're spending the next sort of 35, 40 minutes with during a session. Okay. So let's just take a moment really to just think about the NHS, the National Health Service across the UK, and just kind of think about what it is, because in essence, it's all about the people. One of the terms that we use a lot across our trust is that our product is care. So we don't produce anything. Our chief exec will often say, we're not making baked beans. We're dealing with people's lives. So from an innovation and improvement perspective, it's a little bit different than working on a production line, because obviously our service and our product is care, and it's all about the people that we are working with that deliver that care. So first question, it's not going to be too much of a quiz for the rest of the day, but first question, how many people do you think work for the NHS across the country? So across the UK. I'm just going to pop my chat out so I can see on my second screen. Have a guess in chat for me how many people you think work for the NHS across the UK. Let's see what we get coming through. Okay. So we've got 800,000, 500,000, 1.5 million. Any more? Okay. Okay. First gold star goes to Gordon. I think may have known that information before. You might know the second answer as well, Gordon, if you remembered it. Okay, so we've got 1.5 million employees across the UK. That's a lot of people. That's a lot of people. Okay, how many different roles? How many different roles do you think there are across the NHS? Wait for Gordon to reply and copy him. Not sure about this one. Not sure about this one. Okay, the different types of roles. Oh, I've got some people that are close. It's about 350 different roles that we have across the NHS. So when I say it's all about the people, it really is all about the people. Okay, let's take us on our journey of improvement then and our approach to improvement. So historically, the NHS could have been seen and was seen as a very hierarchical organisation, where the traditional approach to improvement is that decisions about how things should change and could change were made in boardrooms. A very small number of people would sit around a very large table and decide what needed to be changed. And they would have ideas and they would say, right, we need to change this. And it would be more of a push where they would then go to their organizations, go to their teams and say, right, stop doing that, start doing this. And that was a very traditional approach to improvement. You'd often have plenty of committee meetings and board meetings about that. And it would be decided and it would be recorded that that was the right thing to do. And then that push element would then be pushed down to the teams to say, this is a good idea, now go and implement it. And then something happened. Something happened in March 2020, and we were about to go into a period of time like the NHS had never seen before. So as we were starting to deal with the outbreak of our international pandemic, there are a couple of things that really came to light for us. It was the most rapid response to change in the NHS's history. And there are a couple of elements that made it so different to anything else that happened before. So first and foremost, there was no corporate memory. Nobody that worked within the NHS in 2020 had experienced something similar at this magnitude before. The landscape was constantly changing. So we'd learn something, we'd get some guidance down nationally, regionally, and that could change weekly. It could change daily. It often changed hourly. So to be able to change those ideas and think about, right, we know this now, right, it's now this, that kind of speed and the rapid response that we needed to be able to respond to this changing landscape really was like no other. We also had quite unreliable horizon predictions. So in the NHS, we have a lot of data. We can do a lot of predictions. But as we hit this pandemic, especially in those early days, sort of towards the end of February, the start of January, those predictions were really, really unreliable and would often change weekly, daily, hourly. So what this created for us was a real level of uncertainty. Each day we didn't quite know what the data was going to tell us, what was going to happen nationally, what the directions of travel were. So that uncertainty really was felt quite starkly for us within the NHS. And fundamentally, not one individual knew all the information or had all of those answers. So when we refer back to those 8 individuals in that boardroom, those 8 individuals in that boardroom did not have all the answers. So what we had to do at that point then is reach out to our people, reach out to our specialists. We had our respiratory specialists that had links with the respiratory consultants across the country, across Europe. We had also sort of shared experiences with other healthcare professionals across the country. So what we had to do then is to really think about how do we work with those experts that are on the front line, and how do we ensure that we're listening to and we're taking into consideration their thoughts, their ideas, and their learning from their networks. So it absolutely was for us to stop the boardroom decisions and start to think about how we approached our improvements and our changes very differently. So for the remainder of this morning, I want to talk you through a model that we started to implement and we continue to implement. And I'd ask you today to really think about if any of these principles and any of these elements could be used in your innovations and in your improvements within your organisations. So I'm going to talk you through a model. It's got 4 elements to it, and we're going to dive into a little bit more detail for each of these elements. So these alternative approaches is a clear and understood organisational objective or objectives, okay? Accepted permission and agency of employees, and we'll really dive deep into what that actually means in a moment. Innovation methodologies. So these things can't just happen. We need governance around them. We need models and frameworks around them. If we're doing something good, we should be able to share it. We should be able to motivate others so that when we've got a good idea in one area, we can share it across our organisations, across the country, across the NHS, and those support mechanisms as we are going through those changes. And then really encouraging that culture of experimentation. So really having that kind of giving it a go within the governance and within the frameworks to see if we can test new ways of doing things, or having tests of change, as we call them in the NHS. So first and foremost, clear and understood organisational objectives. One of the things that we learned in 2020, and we continue to learn now, is that people need to understand why they are being asked to do something. So it's fundamental for us to be really clear when we start an innovation or we start an improvement. Why are we doing it? What is the problem we're trying to solve? So I often call this the I need an iPad syndrome. When I worked in IT about 10 years ago, I would have a number of phone calls almost weekly, and it would be, Linz, I need an iPad. And I'd go, right, okay. What is it that you needed? What do you want to do? Well, I need to be able to walk around the wards, and I need to be able to see my wards on here, and I need to be able to see all the actions. And I'd say, Our computer system it's not supported on an iPad. So if I buy you an iPad, it won't work. So understanding the problem, really getting fundamentally to what's the problem we're trying to solve. The problem was I need to have a device that I can see my ward details on and be able to input into them. Okay, that's the problem we're trying to solve. The device wasn't an iPad, it was something else. So really, really understanding what's the problem we're trying to solve right at the start and not falling in love with the first solution you think of is really, really important. Setting those clear outcomes. So when we understand the problem, really being clear around this is the problem, where do we need to get to? Thinking about those measurements, thinking about those outcomes, thinking about that data around what do we want to watch, what we're going to keep our eye on here to understand if we're actually making that innovation, that change, that improvement that we really want to do. Trust those that do the work are best placed to improve the work. So one of the fundamental learnings around what we've been through over the past 5 years is that boardroom mentality of I know best. Actually, speak to the people that do the work because they're the ones that will come in, day out and say, if only we could just do this, change this, add this, remove this. And that's where fundamentally a number of your improvements could and should come from. And as leaders, then we need to lead and light that way. We need to create the environment in which this is how we set off on our journeys for improvement. Okay, principle 2. Accepted permission, excuse me, or agency of employees. Okay, really, really important that we've got accepted permission in bold there. So you'll see the picture there on the right-hand side, courtesy of NHS Horizons, one of our national organisations. And somebody saying, honestly, go ahead. No, you've got permission. No, really, off you go. And individuals going, really? Have I really? Having that agency and having that belief that those people do have permission to have ideas, to make those improvements is really important. And the behaviours that we model around that will either endorse that or it will absolutely break it down. So if somebody's got a good idea, one of the exercises that I often do is I ask people to give me some ideas and I respond very differently to them. So somebody might have an idea and I go, well, that's stupid. And then somebody else will have a similar idea and I'll go, great, that's brilliant. Oh, talk to me more about that. Let's really think that through. How motivated do you feel that first person is to have another idea or think about something in a different way? You've shut them down. You've dropped them down at that point. So actually our behaviours and our reactions and responses to improvement are fundamental if we want people to believe they have permission and agency to think about those ideas and those improvements that they want to make. To be able to do that as well, it's really important to create space and to listen. Okay, so I often say 2 ears, 1 mouth. Use them in that proportion. So listen to those individuals, listen to those people that do the work, listen to their barriers that they might have at the moment, their constraints that they might have, and try and work with them and co-create those solutions so that we understand our outcome, we understand strategically where we want to go. Right, guys, how can we get there? Let's talk about it. Let's co-create these solutions. Okay, principle 3, methodologies. So in all of the time that I've worked within the NHS, I've been privileged to go onto a number of training courses, and I think it's really important that if we're expecting people to make improvements and make changes in their organisations, having the training, the tools, the techniques, the languages around improvement is really, really important. We can't just expect people to just be able to switch it on and do it. And what that allows you to do as well with your training programs is to create how you want to do business in your organisation. So your training programs can really set the scene for how we do business, how we do improvement within our organisations. We follow something called the Model for Improvement in the NHS, and that's part of that is a series of what we call plan, do, study, act cycles. So we plan to do something, we then do it, but as we're doing it and after we do it, we study it. Are we getting the outcomes that we were looking for? Is it working? Is that data and those measures heading in the right direction? And if they're not, then we do something different. So what we don't do is deliver something and then just beat people and say, make it work, but it's not working. Keep making it work. We sit down, we listen, we understand, actually, it's not working for these reasons. Can we try something a bit different? Yep, let's tweak it. Let's amend it. Let's go again. We often talk from a governance perspective around attention. So if you're anything like me, if you know that you have to go and speak to somebody about an improvement, then you're going to want to have made some progress before you go and speak to them. So attention really is the currency of leadership. Those routines and practices, those regular, talk to me about how it's going. What are your barriers? If I've got to go and present something to somebody, I am more likely to have delivered something or keep on top of it or ensure we've taken another step forward. The other methodologies are around sharing. So one thing that we really do across Herefordshire is share, and I'll talk to you a little bit later about how we do that. But sharing improvements is really, really powerful for a number of reasons. First and foremost is to celebrate. So if somebody's done something good and they've made an improvement and we've seen a change in the outcomes, great, let's celebrate it. But as we're celebrating that particular piece of improvement, not only are you motivating that individual, oh, that felt good, I'm going to do another one. You're also potentially motivating the people that you're sharing that idea with. Those individuals might think, oh, they did that. I wonder if we can do that. We're thinking about changing that area. Let's follow what they did. So actually what you're doing is motivating the individual, but then you're starting to spread that improvement and innovation across your teams, across your organisation. And at that point, then you can open the door to collaboration. So it might be that individual has gone about to make a change. You've motivated somebody else to do that change as well. You're then encouraging those new teams to go and speak to that individual, go and see how they did it, go and learn from their lessons, go and see what worked well, what didn't work well. So that collaboration space really starts to open up as you are sharing those ideas that individuals and teams are doing within your organisation. And then there's that support mechanism. So I would always say, and we do say as well within Herefordshire, once people have had that training, they've got their tools, their techniques, help them along the way, support them along the way, because we know that classroom learning around improvement and real life improvement are two very different things. So really think about how you want to coach and mentor and support individuals as they start their improvement journeys. Okay, finally, culture of experimentation. How can we embed that culture of experimentation? Well, culture, in essence, is what you do and say every day. That's kind of what makes the culture of your organization. So thinking about the words you use, thinking about the reactions you give are so important. So if you want to create a culture of experimentation, allow experimentation to happen. Think about how you're going to react. Create that governance around it. We've talked about governance, we've talked about training, we've talked about those frameworks around it. But once you've got that established, think about how you will support that experimentation. And how are you going to react to that? How are you going to respond as people are doing that? How will you encourage that? And what we often say is approach all of this with curiosity. So seek first to understand and then to be understood, as Stephen Covey quite eloquently put in his 7 Habits of Highly Effective People. So you've got somebody, they're starting an improvement, they're starting experimentation, and you're thinking, crikey, how is this going to work? If I storm in and go, what's happening here? What are you doing? Think about those words. Think about how that's going to make those people feel. As opposed to me going in and say, hi guys, I've heard you're about to do something. Talk to me about it. How's it going? How are things happening? You know, where have you been? Who have you spoken to? That's a very different way to approach it than going in and seeking to be understood. Go and understand it first with those individuals and really get to know the processes that they're going through. Okay, they're the 4 principles. In essence, it's all about the people. If we want people to change what they do, how they do things, how they innovate, how they improve, we've fundamentally got to think about the people that are doing that work. So I mentioned earlier, one last one, apologies, before I move on to my sharing collaborative. I love this. The biggest room in the world is the room for improvement. I think that's a fantastic statement. And I often recall this in meetings and in areas when I'm working across the NHS. But I want to add a second bit to this quote here. So the biggest room in the world is the room for improvement. So let's make sure that room is full of those who can make a difference, because without them, nothing will change. So let's fill that room with the people that have got the ideas, that have got that expertise, listen to them, support them, mentor them, to enable them to make the changes that they want to make. So before I finish, very finally, one of the ways in which we do this, and one of the ways in which we give our colleagues and our staff and our organisations the opportunity to share so that we can celebrate, motivate, collaborate, is we've created something called Transformation Tuesday. Every other Tuesday morning, hosted by ourselves, we invite people to come and talk about innovation and improvement. And when we set this up a number of years ago, we set it up just after COVID in the June of 2020. We wanted to put this on Teams, this brand new kind of technology that the NHS had not really worked with before. And we realised with a Teams invitation, there were no limitations for who could receive that invitation. So if it was a boardroom meeting and there were 8 chairs, physical chairs in that meeting room, then 8 people could be invited. With online meetings, the world's our oyster. So we decided to open it up and think to ourselves, do you know what? Let's open the door to anybody and everybody who has an interest in the healthcare and well-being of the residents of Herefordshire. Let's open that door. Let's make improvement everybody's business. Let's collaborate, let's share, let's motivate across the system. We also made it, if we were opening it up to so many people, we also decided, well, we can't make it mandatory. We can't make people come to this meeting. So if you can't make somebody come to a meeting, how do you get them there? How do you get them to want to come to one of those meetings? Well, we've got to make it fun. We've got to make it so they want to be there as opposed to have to be there. So let's not make it a meeting. Let's make it something completely different that people haven't experienced before. And as we're doing that, let's continually improve that particular meeting. So let's do the plan, do, study, act on that meeting as well. Let's tweak it, amend it, let's change it and improve it every time we meet. And that's what we did. So we opened the door in 2020 and we said, let's see what happens. So as of the end or the start of 2024, we had over 50 different organisations invited and have presented on that particular improvement forum. So we've opened it up. We've opened it up to the voluntary sector. We've opened it up to our colleagues across the country. We've opened it up to colleagues in local authority and mental health. We've opened it up to so many other different individuals so that we can share and motivate and collaborate across the system. And in June this year, we will celebrate our 5th year. So in June this year, around about the 23rd of June, the nearest Tuesday to the 23rd of June, we will celebrate that we've been having this forum every other Tuesday morning for the past 5 years, because what we want to do is to empower individuals for them to feel like they want to make improvements and support them to deliver those improvements. I'm going to stop there. I'm going to leave some contact details on the screen for a moment. I'm going to take a breath. And I think, Zena, we're going to open for questions, comments, or reflections.
Thank you, Lindsay. And I will just add, having attended some of those Transformation Tuesday sessions, that those sessions are so well attended. I mean, you do get over 100 attendees at most of those sessions. And also they have spawned sisters and cousins and aunties in NHS Trust around the country. So I think you should be really proud of that sharing initiative, because having attended, it worked so well. So does anybody have any questions for Lindsay? I know I've got one, so I'll kick us off. And it is around that notion of accepted permission, because I guess without accepted permission, we're almost slightly paralyzed with what we can or cannot do. So how embedded has that concept become? I know COVID acted and almost forced people to change. But how embedded since that point has now that kind of concept of accepted permissions kind of filtered into the culture of how you do things? Or go locally rather than as broad as the NHS.
Excellent, thanks, Ian. And that's a great question, actually. And I think upon my reflections, those of us that have been around since pre-2020 have really accepted that to be the ways of working. And I'll talk about different levels here. So you've got individual levels. So we've got a number of new staff that we have employed in the NHS over the past few years. We've had a number of people retire, a number of people leave the NHS, understandably, after our experiences of 2020 and 21. So those new staff coming in, especially if they are new to the NHS, that's a challenge. That's a challenge because they are new into this role and they could be potentially kind of a little bit nervous about that. So one of the things that we do is that we deliver our improvement training to the people that are just joining our organisation. We call them preceptees. So we're pulling in processes to ensure that we can embed this across our organisation. So a new employee through preceptorship will receive this training and will be delivered this message. You have permission. This is the framework we use. This is how we do it here. So it's really important that we get those new individuals in because we've had a number of new people in our organisations. Let's take it then to boardroom. So in Herefordshire, our executive board is a very stable executive board. They've been around for a number of years. They've also had their training. They've been through that training. They've worked through the ranks within the NHS. So they understand, they know why. They understand that. So I think in Herefordshire, because we've had stability from an executive perspective, it's just become our language. So we're about to do our planning for 25-26. I'm doing workshops at the moment. The execs have set their outcomes. They've said, go and speak to the teams. These are what we're looking for. Go and speak to the teams and tell us how the teams want to get to those outcomes. What are their ideas? What do they want to do? So we're 100% not there across the whole organisation, but new people and executive level, they're the key elements in which to ensure that we continue to endeavour to embed that throughout the organisation. Don't just think it's one or the other. It's got to be both.
Great, thank you. And I love that you've gone throughout the organisation with your training, whether it's the senior leadership team or the person at the coalface, as we would say, then everybody is getting the same messages, which is so critical.
And we're quite specific about that as well, Sina. So there is no rank or role or grade for our training. Depending on, we offer different levels of the training, but all of the levels are open to all individuals. And we open that up across the county as well. So we have voluntary sector in there as well. We do cross-organisational training as well. So we can collaborate and motivate and celebrate together.
Thanks, Lindsay. Any other questions for Lindsay?
Just one from me, Lindsay. Have you had something that's come up in a Transformation Tuesday that has been a major thing that everyone's jumped on and seen as an immediate opportunity?
Really interesting. So I would say 90% of the time, Emma, there's at least one, if not more, connection made. So we had, I'll give an example because it's the latest one. We celebrated its LGBTQ plus month in February. We had a presentation last Tuesday on that particular topic, and then we had a school nurse who was about to go and do some work in schools, and she said, oh, I could really do with some information about that. And the lead said, yep, I'll come and talk to the school. I'll come, let me know when you're next there and I'll come. So I think for me, Emma, it's continuing to connect individuals throughout it. So I don't think we've had an example where one person said, I'm doing this, and then everybody or the majority have said, that's great, let's do it. But it's all of those. If I could map it, I'd love to map all the dots and all the lines of all those connections to create that bigger picture. But 90% of the time, there's at least one collaboration or connection. Thank you.
Right. Any last questions before we bring it to an end? Well, thank you so much then, Lindsay. Thank you for sharing. Thank you for your energy you've brought to this morning's session. And as I say, I'm sure if anyone would like to attend one of those Transformation Tuesday, I've been to a couple of them. I shared a bit about Ideas UK on one of them. You would be more than welcome. As I say, Lindsay said, it's open to all. So if you'd like to go along and find out what they get up to, you would be most welcome. So thank you very much. And thank you to all of you for coming along. Hopefully you'll join us at the next session where we're focusing on AI and what AI can deliver for us in innovation. So see you then. Thank you.
Thanks.